When a patient presents with blocked arteries, stenting may be sufficient to keep blood flowing. The procedure takes place in the cath lab. The patient is awake and alert. A local anesthetic is applied to numb the catheter insertion area. Then the narrow areas of the arteries are located by injecting dye and reviewing live X-rays called fluoroscopy. Through a needle puncture in the groin or arm, the doctor inserts a catheter guided to the location via fluoroscopy.
When catheterization was first developed, the original procedures were actually done through the arm by making a little incision in exposing the brachial artery. And it was really a minor surgical procedure. And that worked very well for a number of years, but it was fraught with a relatively high rate of complications. And basically the procedure evolved to get access from the femoral artery, which is basically in the groin creases in either leg. And for many, many years, that has been the standard. As our equipment has advanced, we've realized that we can maybe do things one better. Now, oftentimes what we're doing is getting access in the radial artery, which is a small artery that sits right under the thumb. The radial artery is small, it's smaller than the femoral artery, and that would be a limitation in years past. But as equipment has evolved to the point where we're able to do complex procedures with smaller and smaller catheters, we can easily access the radial artery in a majority of patients.
A catheter is directed to the coronary artery that is blocked. A balloon is deployed to open the artery and press a stent, or small wire mesh tube, against the artery. The balloon opens the artery. The stent keeps it open once the balloon is deflated. The procedure is highly effective with minimal risks and few side effects.
There are really two major areas where this procedure may provide an advantage for the patient, and the first is comfort. Immediately when we're done, we take the tube out. We usually put a bandage or a little splint-type device on to control the bleeding, and the patient can sit up immediately after the procedure. Traditionally, after a procedure from the leg, you have to lie flat for several hours. The other major advantage is that it's because it's a small artery, because it's relatively easy for us to gain control of afterwards, the risk of having a bleeding complication from a catheterization procedure is very, very low. It's really evolved. It's the same disease and the same problem, but it's evolved from a technology standpoint to really a much simpler thing for a patient to go through.